afternoon, everybody. First of all, I want to express my gratitude to the Western Poultry Conference organizers for providing this opportunity to me to be here and to present to you. The topic and the title of the presentation, as you could see, is Infectious Bursal Disease. Don't let immunosuppressive diseases get you down. The goal of this presentation is to take you down the road of, from a practical perspective, talking about infectious bursal disease. How do you suspect that you may have exposure to this virus in your flocks? And how do you go about diagnosis? And a little bit at the end, I will a little bit talk about different groups of vaccines that are out there and some strategies around how to control the disease. If you look at the list of immunosuppressive diseases, in this slide you could see quite a long list, and it's not just limited to all of these. There are some other infectious diseases that can cause immunosuppression, and I have it on the table on the top. I mentioned about IBD, probably the most common one. If I want to put a priority, that would be my number one on the top of the list. And there are some other viral diseases that you could see that. There are some bacterial diseases that also can cause that. Inclusion body hepatitis, IBH, can be also immunosuppressive. And in fact, having both IBD, Gumboro disease, and infectious IBH or inclusion body hepatitis in the same flock would definitely increase the magnitude of the losses in that particular flock that is affected on a concurrent infection for both of those diseases. Reovirus, another example that can cause immunosuppression. So it's not only IBD, although it is on the probably number one on that list. And then at the bottom, I'm talking about environmental factors, I'm talking about management practices. All of those can cause immunosuppression because if they are all stressors on the bird, and the stressors, if they are high enough, can actually lead into immunosuppression. The same is true for us as a human being. If you increase the stress level of any particular environmental factor, you actually predispose yourself to become immunocompromised. In this picture, if you look at the immune system of the birds, basically you have the Harderian gland, you have thymus, you have a spleen, you have gut-associated lymphoid tissue, and then you have cecal tonsils, and then eventually at towards the rear end of the bird, you have this round-shaped tissue or organ, which is called bursa fabricis, or we usually use the word bursa on that. And that's the kind of a look at it, the picture of a bursa in about 35 days of old broiler chicken that you could see. Probably it's the most important initial immune system in the bird, because the first few weeks of life in a bird, especially for broilers that only are kept for around 6-7 weeks of age, a majority of the cases, this organ would be the most important immune system of the bird. As the bird gets mature, especially in your long-lived birds such as layers and broiler breeders, then this organ eventually, after around 12 weeks of age, would regress, become small, and basically its job, it's done in a mature bird. In a broiler breeder, a mature broiler breeder, or in a layer bird during production really doesn't have any place there, because they already have done their job. The immune cell have migrated to other immune system in the bird that I have, I'm showing it here, and so they don't have any more jobs. But in broilers that are kept in a very short lifespan, the bursa fabricius is the most important immune system in that bird. There are two different kind of, if I want to categorize those, there are two different kind of manifestations of IBD in flocks. The disease doesn't affect turkey, so before I forget about that, it's basically exclusive to the chicken flocks, and that's the species that is mainly affected by that. But the manifestation of the disease are classified in two parts. The clinical, which means that you actually can cause disease by itself, IBD viruses in that scenario, and it can cause mortality. Yeah, the vet, when they open the bird in a necropsy room, they could actually see the lesions and suspect IBD. We do not have any indication that, at least on the commercial side, no indication that we do have a clinical cases. And those two that I have mentioned on the top, classical strains and VVIBD, meaning very virulent IBD, very widespread in Middle East, Asia, Latin America. We have a little bit of a classical strain also in some of the parts of the North America, but definitely we don't have uh, evidence of that in our broiler flocks in Canada, in commercial broiler flocks. What we do have is the subclinical form, and that's what it makes it very difficult. It's also the most common one in US, although the US recently had some of these category cases in especially in California area. But the subclinical makes it very difficult because it doesn't cause an overt manifestation, clinical signs, doesn't cause, other than affecting the bursa of the bird, it doesn't really cause any other. What it basically does is predisposes the bird to become immunocompromised and therefore more prone to be infected by other secondary infection. You would have a lot of leg problems. You could see some increased condemnation, cellulitis more specifically, when you get the report back from your processing plant. You may have some E. coli problem, leg problem. Your IBH cases would cause more losses. And definitely because it's immunosuppressive, there would be a poor response to vaccinations. This become even more important in long-lived birds. However, long-lived birds, such as layers and broiler breeders, because they have a more or a slower growth rate during the first 6, 7 weeks of life, then they are less susceptible, I would say. They are still susceptible to the subclinical or variant strain of IBD, but less comparing to the broilers that have a very fast growth rate, and the lifespan of maternal antibodies that is coming from their breeder hen mothers is shorter. So basically, your variant strain of IBD, which we have in Canada, is your silent enemy. They don't really directly cause mortality. You have to look for it and you need to identify it, diagnose it, and then deal with it to get rid of it. So these IBD infection can cause severe damage to that bursal organ that I mentioned. Basically, this organ here, or at the end of the bird, this is the organ that is affected by the variant strain. So in a normal bird, it has a certain size. In affected birds, it becomes atrophied, it becomes smaller. Most commonly identified in Canada. Now, when you go and send samples, bursa samples to the diagnostic lab, there are different diagnostic labs that will process and are able to do molecular tests on these bursa sample. One of them is University of Guelph in Ontario that I use a lot. They give you a name to those variants because even though we call it a IBD viruses, not all of them are the same. The pathogenicity, the aggressiveness of these viruses are different. Now, when you send the sample to the lab, it comes back as some of these nomenclatures. It calls like IBD with this long list of letters and numbers. It only tries to give a label to it. Your vet would basically be the best person to make sense of some of these. If they're saying that there is a Delaware E or North Carolina 171 or South African H, which is the bottom one, SAA. So these are the most common ones that are identified. But again, for a producer, that's not the big part of your attention. You need to work with your vet to make sense of what is the importance of it, but it's more from an epidemiological point of view that we really need to know what kind of sequences, what kind of variants are out there. But also, it's important when you're dealing with your breeder vaccination and also your vaccine program that you're using in a broiler flock. Okay, so what are the indicators? So if you are a broiler producers, and what are some of the indicators that you may think you are dealing with the IBD subclinical infection? You sometimes you don't see anything. The chick quality started to come to your barn at the placement during the first week. It's a very nice flock, good growth rate, less first week mortality. So everything is perfect until the birds get a little bit older, and then you start seeing affecting the performance of the bird. The FCR is a little bit high. Then you start to have more leg problems, for example, mortality due to E. coli, non-specific. You can't say what is going on here. Obviously, if you have a bacterial infection, then you need to use more antibiotics. And the bottom line is that your return on investment is definitely compromised there. Your uniformity will be affected. And when I list all of these here, I wanted to emphasize not all of them would happen all the time. You may just have a little bit of a couple of decimal increase in FCR, a little bit increase in cellulitis or condemnation. You may have all of that, which is a more severe cases, but you may have just some of that, not all of it. But what my recommendation, my suggestion is that never ignore those signs, because those signs gradually will become bigger, and that is the time that it will be more costly at that point to deal with the IBD variant issue. You may even have some mild subclinical coccidiosis, because again, because it's an immunosuppressive disease, the bird gut system would not be as effective fighting against some of these coccidiosis or Eimeria that are in the gut. So therefore, even though you're using a medication program, the bird still needs their immune system to fight off these diseases. So you may even have some coccidiosis in a subclinical form. Obviously, with the coccidiosis, you would have some increased FCR, even if it doesn't kill the bird. Your average daily gain will be affected. So you need to consider all of these things. As again, I don't want you to look at the list and say, I don't have this, so I don't have the IBD. No, it can be 1, 2, 3, all, depending on the level of infection, depending the age that the flock is exposed to the variant. You may have some or none of those actually. Now, when we think about the bursa, you have to realize that the bursa, so if you weigh the bursa and weigh the body weight and you get the ratio of the bursa to body weight, actually the bursa becomes bigger as the bird ages. So in other words, that ratio bursa to body weight will actually increases to a certain stage. The first 3 weeks of life is probably the most critical part of bursa maturation, because the cells, the immune cells, which we refer to as B cells, are going through the differentiation. They are becoming mature. So if the bursa is affected during the first 2 to 3 weeks of life, then that bursa that bird would be a permanent immunosuppressed. That would be the most severe cases, because then it definitely would affect your performance. The good thing is that during that 2 to 3 weeks, you also have maternal antibodies from your breeder hen that is protecting to a great extent against these field exposure. And fortunately, in Canada, from west to east, our broiler breeder flocks are receiving at least 3 live vaccine of IBD, and then 2 kill vaccine during the pullet stage, which provides a good level of maternal antibodies that will protect your broilers for the first 2 to about 18, 19 days of age. After 3 weeks, there is a plateau stage. The bursa doesn't really become bigger anymore because the cells have matured, replicated. There is a plateau. So that's at week 4 to 8. They're well developed and it's a plateau stage. After about 9 to 12 weeks, depending on the type of a bird, if it's a broiler versus commercial layer or broiler breeder, it's a little bit different. Then the bursa, if you keep that bird living after that, then basically the bursa will shrink. Why? Because it has done its job. All the cells that have matured have migrated to other immune tissues of the bird that, the thymus and bone marrow and other organs that I mentioned earlier in this presentation. And the birds will shrink. As I said, if you go to a 26-week-old layers, for example, it's hard to find bursa in that bird because the job is done. So that's why in broilers, the most important part, because the lifespan of that bird is about 6 to 7 weeks, depending on the type of bird you're raising, but roughly around, let's say, 35 days of age. Then really the most important immune tissue there would be this bursa that would be affected by this virus. Okay, so let me go to diagnosis a little bit. This is important because one of the probably the easiest way to assess the health of a bursa would be actually when you take 6 birds, which is randomly selected in a given broiler flocks. You euthanize birds and you open the bird, you do the necropsy, or veterinarian would do the necropsy. And then one thing you could do, you could present the bursa, which is again, it's a rear end of and these are the bursa from different birds. And you could actually see the sizes. So these are all the same sizes within a given flock. You see as small as this one on the right side, and then you have this one on as big as this one on the left side. And then what we use here, we call it a bursometer. It's a tool that we use, especially if you are early in that looking and assessing your bursa of the birds. You need something to measure the size of it. And then the holes here has different sizes. And at the bottom, as you can see, 1, 2, 3, 4, 5, 6, 7, 8. So over time, at a certain age of a broiler flock, like let's say 30 days of age, you open 6 birds and you measure the bursa, you expect to see in a non-challenged flock to be around, let's say, 7, 6, 7. But if you suddenly open a 30-day-old bird and you have a bursa that is around 3 or 4, you may suspect you have some immunosuppression there. I want to re-emphasize that just a small bursa doesn't mean you have IBD, because as I said, there are other things that can cause the smaller bursa. The other thing you have to realize is that the age of the bird also will affect the size of the bursa. So you need a good experienced eyes to look at bursa. The person, your vet that has opened many birds over many years would be the best resource in that case. The tool is basically just a tool to capture some of those. So if you communicate that back to your veterinarian, you could actually say, well, the size of a bursa is this. Or the vet, actually, I use it myself too when I open the birds, because it gives you, and you record it, and you have some kind of objective measurement there. Now, let's look at this. So gross assessments of bursa size. In a normal bursa, I told you one of the criteria you have to make sure you realize is the age of the bird. So a 7-day-old bird may have a bursa of size 3. The same bird, if you lives for up to 35 days of age, might have a bigger size. Well, is going to have a bigger size, maybe the size of 6 or 7. So, age is definitely a factor. In a normal chicken, different ages, you have different sizes. Okay, so let's say you select 6 birds, and which is a representative of a broiler flock, euthanize them, and then you do the necropsy, or vet doing the necropsy, you look at the bursa, one flock has this bursa's the same age on a different flock. Uh, let's say one barn has this one and the other one has this size of a bursa. There's no difference between the vaccination program between the two barns. That actually might be an IBD suspect. Again, it's not enough. At this stage, you are saying, well, there's something going on with my bursa. It's smaller. Then definitely you need to talk to your vet because there are a few things that can affect it. You may actually indeed have an IBD infection, but you also, some of the vaccine that you use can affect the size. It's very normal because that's the take of a vaccine. When they go and do their job, you need some of the vaccines, especially the intermediate vaccine or stronger vaccines, would cause some of these different smaller sizes. In addition to a field challenge that also can cause that. Okay, so you want to now make a sense of that. As I said, as a second step or the next step is that you want to see whether you have IBD or not. You did select 6 birds, randomly selected. And I think I would suggest that, one of the best way is that every flock, you actually ask your veterinarian to do a random health check. And within that random health check of your broiler flock, for example, you select 5, 6 birds. That's what I suggest. And but those birds shouldn't be the cull bird. They should be a representative of that flock. And then you do the gross assessment of the examination of all organs, but including bursa. You have the bursometer. Then, if you suspect it, one thing you could do is to take blood. That's probably the second cheapest approach to assess whether you have an IBD infection, is to do ELISA test. And most labs are able to do that ELISA. And I will show some of the actually results of that. Interpretation of those results is important because it depends. One of the factors that will be very important in whether or not you see a titer in the serology result is whether the flock is infected at what age. So let's say your broiler flock is infected with IBD today, you go 3 days after and take some blood sample, send it to the lab, it may come back as negative. Why? Because the bird needs at least 10 days to 14 days to basically the immune system to produce antibodies that you can measure it with that test. So if the flock is infected at around 22 days of age, and you take sample at the processing at around 35 days of age, then you actually see a good titer because the bird or the flock had enough time to be exposed and show high titers. So again, the interpretation, you have to think about it. Now, what I suggest is to do, when you take the bursa, you take half of that bursa, you put it in a formalin jar for histology if you want to send it to the lab for histology, for the histopathology to look under microscope and look at the cell structure of the organ. For the molecular, you need to freeze it. You need to put it in a Ziploc bag, 5 bursa or 6 bursa from the flock that you're suspecting. Put in a freezer until you want to send it to the lab for molecular diagnostic. Okay, so let's look at 3 different scenarios. I'm going to go through negative scenario, looking at the serology and molecular, and then suspect, and then positive. That way it makes probably a little bit more clear on your side. Okay. This is a negative case. So this is a ELISA, typical ELISA result that you may get. Now, different lab may have different manifestations, but what you have here on this graph here, you have the number of samples here, and then you have the titer group. The titer group is basically depends on, like in this case, it's an IDEX case, depending on what titer group you're looking at. And if I want to show you what titer group that those mean, let me just go to this. So this is, for example, titer group 1 is a titer of 397. Titer group 6, for example, is 6,200. So if you have a mean titer of 10,000, it tells you that that average titer of that group is around titer 8, which is down here. So titer 8 would be here. And then this bar graph shows how many birds have around that titer. So in this one, that what you look at is that the number of samples, 4 samples were submitted. The mean titer was 21, basically 0. Geometrical mean titer is the one that I look a lot. That means that you take out the outliers and it gives you a mean. It can be less than this, and usually it is, depending on your CV. CV, or coefficient of variation. The last one is important. It basically, the tighter it is, the less, the smaller it is, it shows that you have a tighter group. And that's very actually helpful because it gives you the level of challenge. But also, if you're looking at the long-lived bird vaccination program, this also gives you an idea about whether the vaccination, especially kill vaccination of broiler breeders or basically broiler breeders, have been done properly or not, and whether or not you have a good maternal antibody that go to the progeny. So that's a negative because it's basically 0 here. Then you also can send that frozen bursa to the lab for diagnostic, for molecular diagnostic. So it's a flock of 34 days of age. It goes there. That's the bursa was submitted. That's the type of a tissue. CT value, or this number here, it's basically the number of virus in that sample. The smaller that number, that means you have a higher load of virus in it. So that's the kind of an inverse relation. And then it says negative. So that's a typical. You didn't have any serology. You didn't have any virus present based on the molecular diet. So you have a negative case. This is the titer group that I mentioned. Okay. The positive case of IBD, that's another good example, very clear cut. You go and let's say you, in your previous flocks, you had high condemnations. It's at 2-3%, or higher even sometimes. You take blood samples at the processing around 35 days of age. And then you have these titer. Look at that. So when you look at the mean or geometrical mean, you have 11,000 titer. For a broiler flock, doesn't matter what vaccine you use. At 35 days of age, you do not have 11,000, regardless of whatever vaccine you use. So that's a clear, very strong suggestion that you do have IBD infection. Do not ignore that, even if you don't see a very clear-cut performance issue, because it will come and bite your return on investment eventually. So the mean is 11,000. The CV is 25. So it's a really good example of infection there. And then you have the very low CT value indicates higher number of virus in the bursa. As I mentioned before, you do the molecular on that, look at the CT. So the CT value, as I said, it mentions how many viruses on the bursa. 16 is a very high level, and this is very consistent with this titer. So the flock has been exposed to the virus early enough to replicate that field virus and cause this problem. Usually this flock, I would say, had experienced higher condemnation, more bacterial infection, FCR is higher. So there is some performance issue there. It is taking out of your return on investment. I don't know how much, depending on many other factors also, but definitely that's something you need to address. The IBD suspect is somewhere in between. So you take a sample here, the serology is there. It's about 2/3. There are some vaccine that actually can give you this mean titer if you vaccinate those flocks. So therefore, this is not a clear cut. You have some bursa here on the top that are good normal size. They have these smaller ones down here. So this is not a clear cut. You send it to the lab for molecular diagnostics. As I said, the range of this value here, the smaller is, you have higher level of infection. Between 17 and 35. So you are right closer to about 30 here, 27. There is some virus, but I am not sure whether it's because of the vaccine I used or is it really a field challenge. That's where your molecular is extremely important. When you send it for molecular, they give you a very big table. I don't want you to bog down about because it becomes very confusing. I want you to really rely, as a producer, rely on your veterinarian to interpret this result. But what it gives you, uh, the name of the virus. For example, it says it's a SAO8. That's probably the most common variant especially in East and also a little bit in the West, South African origin. Doesn't mean it came from South Africa. It says that within that data bank that the lab had, it is consistent with that virus, which was identified um, by another researchers in another part of the world. But definitely, that's one of the most common ones. So that means that you actually have a field infection. It's not a vaccine strain. And then it also gives you this picture. But again, I don't want you to, because it becomes very complicated on that part. This was a case that the flock was actually vaccinated. There were two barns in that barn. The barn one on your left-hand side, you see an uneven flock. That's the history of that flock. You had moderate to mild coccidia. When you open the birds, you would see Eimeria maxima in those birds. When you look at the serology, they're all over the place. There are some negative, there are some very big positive here, about two of these birds. And then the other barn, everything was normal. The titers were normal. There was no issue with these clinical signs. When we send it to the lab, these are the results of the molecular one. Both of them are positive, but both of them flocks, both of the barns were vaccinated with a very strong vaccine, Bursaplex, at the hatchery. When you did the molecular, look at here. So this one on the top is actually another variant, Delaware A in that barn. But at the bottom, you would see another strain here. This IBD Winterfield 2512, it's a vaccine strain. And that's the barn that did not have any issue. So both barns were vaccinated with the same vaccine program. However, this barn, the vaccine was able to compete with the field virus, that South African strain, and replace it. This one, the barn one, was not. So in this case, that's where your vaccine program becomes very important. The type of a vaccine you use is very important. That's where you need to think about some of those vaccine strategies. Just because of time, I have about 7 minutes here to go. Maternal antibodies, as I said, broiler breeder flocks, the parents of the broiler flocks are heavily vaccinated. Those mother hens will transfer maternal antibodies that will protect your broilers for about the first 2 to around 19 days of age. So I'm not really worried about that challenge. You are exposed after that when the maternal antibodies really gets to a lower level down here. That's the immunization threshold. In a given flock, you have different birds with different, depending on how many sources of breeder flock is providing your broilers in that barn 1, 2, 3, then you have different level of maternal antibodies there. Okay, just a little bit on different vaccines that are out there. There are various levels, but there are live vaccines, which are classified from a strength point of view from mild, intermediate plus vaccines. And then you have vector vaccine that are used at the hatchery. The mild vaccines, these are vaccines are used usually at the hatchery through the spray. They can spare IBD maternal antibodies from the effect of the Marek's vaccination there. And what I want to mention here is that these type of vaccines will also be neutralized by maternal antibodies. So if you use these, they are only going to protect those broiler chicks that have a low maternal antibodies versus the the birds that are having higher maternal antibodies will actually neutralize these vaccines. If for those type of birds, you actually need the second vaccination at the farm in order to protect the bird. The second group are intermediate vaccines. These are stronger. Um, as an example, I would say Brucine 2, SVS 510. These are different brand names that I'm mentioning here, but these are intermediate vaccines. You need to give them in at the broiler farm, are usually around 2 weeks of age. Obviously, there's a 21 days withdrawal there, so you have to consider that one. These vaccines are stronger, less neutralized, but still neutralized by maternal antibodies. But at that age, your maternal antibodies are also declining. And then this one is probably the strongest live vaccines out there, antigen antibody complex. These are given in ovo vaccination with your Marek's vaccine at the hatchery. They have a strong live vaccines. The live vaccines will go and compete with your field wild challenge of IBD. What we recommend if you're using these vaccines when you have a really problem farm that you cannot get rid of the virus by any other milder vaccine. You go up with this one, use it for at least 2 to 3 flocks, and then you could go back to a milder vaccine, always in combination with the molecular diagnostics, with the help and support from your veterinarian. So, wrapping up in the next slide, you need to have a proper diagnosis. And I was trying within this presentation to kind of give you an idea of systematic approach to diagnosis of IBD. But there are times that regardless of what vaccine you use, you are not able to cope because the level of challenge is too high. Nothing in that case would be better than go with a complete cleaning and disinfection. I'm talking about complete removal of litter, washing down with detergent, followed with disinfection, let it dry, enough downtime, and then go back with a mild vaccine, vector vaccine, the next flock, and monitor the process. You should be able, by the end of the flock, first flock after this cleaning disinfection, a good vaccine after that, you should basically get rid of that. That's the scenarios that you really have hard time to get rid of that field virus. And there are some certain scenarios. Take-home message for me for the last slide is that because these variant strains not always cause very overt problems, do not underestimate, because if you don't deal with them just saying, well, I know I have titers at the processing, I have a little bit of FCR higher, but I'm okay with it, it's not hurting me. Don't consider, I'm not saying you just to use vaccine blindly, but if you have indication that you have IBD, even if it's not causing a huge performance issue at the moment, don't underestimate it, because eventually it will build up to this level that it actually will eat up your investment there. So it's important, and because of all the complexity around it, first you have to diagnose it, then you have to have a good vaccine strategy, and eventually you may end up with cleaning and disinfection plus a good vaccine after that in order to cope with the challenge. But the first thing first is to really diagnose that you do have IBD problem or not, because that's, as I said, there are many other immunosuppressive diseases that will affect your flock. With this, I think my time is up too, and thank you very much for the opportunity. I hope I was able to kind of at least give you some practical tips about the disease and how to deal with it. And looking forward to the Q&A session. And thank you very much for the opportunity.
Well, thank you, Dr. Sanei, for that very thorough presentation. And let me tell you, the questions are coming in fast and furious. So hopefully we can get to all of them. I'm going to kind of group them a little bit. Let's start, first of all, with the one about, because it relates to what you were just talking about on a full cleaning. One of our participants says, I've read the disease can live for a lengthy time in the environment, and he's wondering how long can IBD exist?
That's a very good question. It's one of the very hardy viruses, so it can resist, especially in the scenarios that you do not clean and disinfect. It's going to, with the organic material like fecal material in the barn, it's going to stay for months if it's not basically very hardy virus, and that's why the breeder vaccination plus proper vaccination at the broiler farm, if there is a case, those two would definitely be needed. You cannot just rely on cleaning and disinfection at the farm just to get rid of 100% of this virus if it's in the barn. So you need a combination of the preventive measures in addition to get cleaning and disinfection.
All right, and another question is that then what role does barn density play in all this?
It's similar to everything else, because if you have a higher barn density, obviously that means that you're gonna, if you're infected, your flock is infected, you're gonna produce more viruses, which is excreted to the fecal material into the litter, and therefore, you have more number of viruses. And in fact, what happens if that when you have an IBD problem, because as I said, it's a subclinical disease, and at the start, you may not see much of a problem, and gradually flock after flock, if, for example, 1 year you're not cleaning and disinfection, you're just waiting once a year type cleaning and disinfection, gradually the number of viruses gets really high. That will affect the overall performance. So the more density is similar to many other diseases would increase the impact.
Yeah, the multiplication factor for sure. We've got a couple of questions related to turkeys. Does the bursa size that you presented apply to turkeys as well? And could that bursometer that you showed be used on turkeys?
Well, the morphology and looking at the bursa in Turkey really hasn't been very well studied. And the reason is because there are not many diseases, or at least there are not very well-known diseases that directly similar to IBD that is affecting the chicken does not affect turkeys. The one that affects the immunosuppressive in turkeys, the most well-known is the hemorrhagic enteritis, which affect the spleen of the bird rather than the bursa. So because of that, no, there's not well understood. E. coli, sometimes they refer to that they can affect the bursa in turkeys, but the ruler that I showed in the presentation is built based on the sizes of chicken. So no, if they could still use it and maybe establish a baseline within their operation, they could use that ruler and then go and every flock take few birds at different ages and establish a baseline and then use that. But again, the importance of bursa is much minimal in turkeys versus chicken. It's a more chicken type importance because of the number of diseases that can affect it.
All right. Can the bursa and its function be compromised during those first few weeks of life that will then have a long-term effect on broiler breeders?
Yeah, for sure. Yeah, it's. I did mention probably in my presentation that broilers are the most susceptible one. But it's the same thing for layers, the first few weeks, the broiler breeder, all of them are susceptible to the virus. The only difference is that, obviously in Canada, broiler breeders are coming from US primary breeders, either by like a day-old chicks or the eggs that are coming in and hatched here in some parts of Canada. Those are also heavily vaccinated. So there is a good level of maternal antibodies in broiler breeder at 2 weeks of age. And because the growth in those birds is slower comparing to broiler chicken, the maternal antibodies that are coming down from primary breeder to broiler breeder, the half-life of those maternal antibodies is longer. So they are less susceptible because those maternal antibodies will last longer. But if you have enough level of infection in a barn, in a broiler breeder barn at that age, you definitely can have an immunocompromise in broiler breeders similar to broilers too. It's just less, less not. And the other thing is the density. Here you have less density in broiler breeder Majority of the time in Canada, they do clean and disinfect the broiler breeder barns. So all of those factors would actually reduce the chance. But as for susceptibility, yes, they can be as susceptible. And if they are affected, definitely will affect the response to vaccination, because you're affecting the immune system of the bird. So those birds may not really react to a heavy vaccination program that these birds go through life. And you will get less antibody level and more problem for that flock.
All right, we're going to switch gears a little bit away from the commercial aspect of it. And the veterinary pathologist with Alberta Agriculture and Forestry, Dr. Madhu Ravi, is asking about small flock producers and this problem there. In their diagnostic work, he's found that Merrick's is in the top 3 commonly diagnosed conditions in his investigations. And so he gets lots of inquiries from small flock producers and veterinarians about Merrick's vaccination. And, you know, obviously Zoetis produces for commercial poultry and large dose sizes. Has there been any consideration about how to respond to sort of the small flock movement and you know, small flock needs in this area?
That's a very good question. And actually, personally, I get a lot of those questions, especially when it comes to the warmer season, that people are starting to have, you know, the small birds raising at the farm, at their backyard flocks. The problem is there are 2 things. First, I guess there is no vaccine. We call it the lyophilized Marek's vaccine. So that vaccine doesn't exist at the moment in Canada. We used to have this vaccine. Zoetis used to have it, but it was discontinued about 4 or 5 years ago. There is a Marek's vaccine, but that one, which is basically all of our commercial broilers are vaccinated with it. But that is kept in liquid nitrogen tank. So only place they can use it is at the hatchery. Right. The only way, I guess, would be, especially if they buy layers, I would say layers would be the main issue. If they are kept for a long time for production of egg, those are the ones that are most susceptible to Marek's disease. For them, I would think the best way would be to actually ask for birds that are vaccinated with Marek's at the hatchery, because the vaccination has to be done at day 1. You cannot buy a pullet at about 16 weeks of age and then vaccinate because it's too late. You need to vaccinate for Marek's at the hatchery. That's the best way to do it. Therefore, if that's the case, then they should ask for a bird that has been vaccinated on day 1. But that's a big challenge in general. We get a lot of these questions, and there is no commercially available vaccine, regardless of the size. There is not even a vaccine available for backyard flocks for Marek's disease in Canada.
So then are there any other recommendations for dealing with the disease? Is it a management thing, or are there any other recommendations for it for small flock owners?
The best is that you limit the exposure during the first week of life. That would be the best, the most important thing to kind of prevent the virus to get into the bird. It actually goes to the bursa and starts there and then migrates to spleen and other parts of the bird. And when the bird gets older, it starts to produce, other than immunosuppression, a lot of tumors in the bird. That's where the problem is. So I would say the first week, if they could limit, like separate the bird for at least a couple of weeks at the start, that would reduce it, because there is an age susceptibility there too. But other than that is to really, if they are going to keep the bird for producing eggs, try to see if they can ask for birds that have received the Marek's vaccine at the hatchery.
Okay. Now there are some trends for reusing litter in Alberta. Would you recommend this, or should we clean and disinfect between flocks? I guess it's a standard.
That's probably a common, especially when it comes to the topic of raised without antibiotics and whether having the litter from the previous flock for the next flock, is it actually positive or negative? And there is a lot of conflicting debate around it. if you don't have a disease, like let's say you don't have a reovirus infection or IBH or IBD, so the flock was performing great, actually having the litter from previous flock might actually help the next flock, because you are actually naturally exposing the next flock to the microflora of a mature bird from the previous flock. It's like a probiotic type thing. But if you do have a challenge, then yes, I would say, so there is a cost and benefit there. I would say you can't write a blank check says you use litter all the time is good. And if you have a challenge, especially the big ones are reovirus infection, IBH, IBD, those, if you have those problems, then definitely you need to do the cleaning and disinfection, because those are, all of those three that I mentioned are very hardy virus. And for coccidiosis, you need to have either medication or vaccination. When you use the reused litter, or even if you clean and disinfect for coccidiosis, you still need to rely on either vaccination or medication in the feed.
Okay, we'll sneak in one last question. Is there any on-farm detection kit, or are you aware of any company that's thinking of moving towards that kind of a kit to diagnose IBD or other common diseases to the farm to have easier and faster primary results? Any kind of on-farm diagnosis?
At the moment, no, but this is a next generation that will come in. So within the next, I would say 5 to 10 years, we would have a list of different diseases that probably somebody will come up with a panel that you could actually, the vets or the producer, they could use it at the farm level. It gives you an indication of kind of a screening. And then if you need more information, let's say it's positive for IBD, then you send samples to identify what it is and deal with based on the result. So I think it's similar to everything. In the next 10 years, I'm sure there would be a lot of those on-farm diagnostic kits.